practice success. Dear delegates, we'll be starting the inauguration shortly. So just give us a few minutes as we get the inauguration things ready. Miracle is a celebration of medical innovation, research, academic collaboration, leadership, and excellence. May we invite you all for this inaugural ceremony with a classical Bharatanatyam, please.
गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
झुम झुम धड़म कुतक तको रद तंगिर तक तरिगिर तक ता झुम तक झुम झुम ता तकिट ता तत झुम तक झुम ता तत तणम ता तत तरुम ता तकिट ता तंगिर तक तरिगिर तक ता तगिट ता दणत ता ऋणत ता दिनित ता दजम ततनम ततरुम तगदिन तकिट तक तंगिर तक तरिगिर तक ता धिम ता तरिगिर तक ता झुम धिम तत झुम Dum da 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 jum dum da kita da na da da tang da 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 dim da 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 jum dim da 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 jum jum da 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 jum da jum jum da kita da jum da 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 jum da 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 jum da 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 tang da 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 jum dim da 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 jum Nam da 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 jum da da dim dum nam da 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 da
Thank you so much, girls. The performance was indeed a feast to our eyes. Respected dignitaries, esteemed guests, distinguished faculty of Madras Medical College, and our undergraduate students who are the beneficiaries of this conference. A very good morning to one and all present here. Education is the kindling of a flame, not the filling of a vessel, says Socrates. With immense pride and heartfelt warmth, we welcome you to Miracle, the National Undergraduate Medical Conference hosted by the historic Madras Medical College, Chennai. Miracle, a celebration of medical innovation, research, academic collaboration, leadership, and excellence, reflects the institution's enduring commitment to nurturing young minds. This year's conference brings together undergraduate delegates from across the country to participate in a thoughtfully curated blend of lectures, workshops, paper presentations, panel discussions, and clinical competitions, fostering inquiry, skill building, and peer collaboration. The planning and execution of Miracle have been a journey of vision, teamwork, and unwavering commitment. As you engage with the sessions, exchange ideas, and walk through the legacy-rich corridors of Madras Medical College, we hope you carry forward the flame of curiosity, compassion, and excellence that defines our profession. Welcome to Miracle. Welcome to Madras Medical College. Let the journey of inspired learning begin. கதிரவனின் பொன்னொழியால் மிளிரும் இக்காலை பொழுதில் இந்த அவையில் உள்ள அனைவருக்கும் எனது முத்தான முதற்கண் வணக்கங்கள். மிகுந்த பெருமை மற்றும் மனமார்ந்த மகிழ்வுடன் சென்னை மருத்துவக் கல்லூரி இவ்வருடம் நடத்தும் தேசிய அளவிலான மாணவர் மருத்துவ மாநாடு மிராக்கிளுக்கு உங்களை வரவேற்கிறோம். மிராக்கிள் என்பது மருத்துவ முன்னேற்றம், ஆராய்ச்சி கல்வியியல் கூட்டாண்மை, தலைமைத்துவம் மற்றும் சிறப்புடைமையை கொண்டாடும் விழாவாகும். இது இளம் மருத்துவ மாணவர்களை ஊக்குவிக்கும் என்ற நிலைத்த உள்ளார்ந்த பாங்கில் நமது கல்லூரியின் அர்ப்பணிப்பை பிரதிபலிக்கிறது. இந்த மாநாட்டில் நாடெங்கிலும் இருந்து வந்த இளநிலை மருத்துவ மாணவர்கள் பயனுள்ள உரைகள், பயிற்சி பட்டறைகள், ஆய்வுக் கட்டுரை சமர்ப்பிப்புகள், குழு விவாதங்கள் மற்றும் போட்டிகள் போன்றவை உள்ளடக்கிய அறிவும் அன்பும் செறிந்த நிகழ்ச்சியில் பங்கேற்க உள்ளனர். இது சிந்தனையை தூண்டும், திறன்களை வளர்க்கும் மற்றும் மாணவர்கள் இடையிலான ஒத்துழைப்பை ஊக்குவிக்கும் வகையில் திட்டமிடப்பட்டுள்ளது. மிராக்கிளுக்கு உங்களை வரவேற்கிறோம். இப்போது ஊக்கமளிக்கும் கல்வியின் பயணம் தொடங்கட்டும்.
May I now call the dignitaries to the dais, please. Our Honorable Justice A.D. Jagdish Chandra of Madras High Court. May I request our organizing chairperson, Dr. Tirani Rajan sir, to kindly accompany him, please. Our Principal Secretary to the Government for Health and Family Welfare, Dr. P. Sendil Kumar IAS, onto the stage, please. May I request Dr. M. Kavita, organizing co-chairperson, to kindly accompany him, please. Our Director of Medical Education, Dr. J. Sangamani, onto the stage, please. May we all rise for the invocation song.
நீராறும் கடலுடுத்த நிலமடந்த கிழிலொழுகும் சீராரும் வதனமென திகழ்பரத கண்டமிதில் தெக்கணமும் அதிர் சிறந்த திராவிடனல் திருநாடும் தக்க சிறு பிறை நுதலும் தரிதனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறம்பியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Thank you. Now, great minds have great purposes. Somebody who has been planning this program for the last 3 years and getting to a success is none other than our organizing chairman, our former dean and present additional director of medical education, Dr. Tirani Rajan sir. So he'll be extremely happy if you can come us for the welcome address, please.
Respected Justice Madras High Court, Mr. Jagdish Chandra, sir, respected Principal Secretary, Department of Health and Family Welfare, respected Director of Medical Education, Dr. Sangamani, Vice Principal and Co-Chairperson of Miracle 2025, Dr. Kavita, other dignitaries on the dais and off the dais, and my dear students. Very good morning to all of you. As a chairperson of this, chairman of the organizing committee, I take this opportunity to welcome you all for this inaugural function. Organizing team of Miracle Conference organized this conference in a short 2 months notice. We have organized this national conference. Delegates from more than 110 medical colleges from across the country have come for this wonderful conference. It is my pleasure and privilege to welcome you all for this conference 2025 organized by the team. Few words about this conference. You might have wondered why a conference for undergraduate medical students. Usually medical conferences are conducted for postgraduates and consultants of various specialties. No medical conference has ever been held for undergraduate students so far for the entire nation. But for me, the idea of full-fledged conference exclusively for undergraduate medical students has been close to my heart for the last 4 years. It was my intention to conduct an elaborate national conference with the eminent faculties covering almost all branches of medicine. I strongly believed that such an academic meet will create opportunities for young medical students to get exposure to eminent faculties, both national level as well as international level. They will not only acquire knowledge, but also will get inspired by listening to the highly accomplished experts and interacting with them. This conference was conspicuously a few months ago. A co-committee consisting of faculty members of different specialties and, more importantly, undergraduate students were formed. We planned every aspect of the conference very meticulously. There was a great enthusiasm among the students of medical colleges all over the country. Thanks to every member of the organizing committee for involving themselves wholeheartedly in the entire process of planning and executing this mega event. We decided to include topics pertaining to all branches and subjects, basic sciences, preclinical, clinical, higher specialty subjects. And we were very particular that the talks should not be in a routine fashion. Each topic would incorporate a clinical scenario and offer the scope for the applied knowledge. The current issue of One Health was included. This concept emphasizes that human health is interlinked with the animal health environment. Also, we include a special session to address the values, attitude, humanness and relevance to medical practice. As a new initiative, a career guidance interactive session also has been included, in which the delegates will interact with the doctor-turned-IAS officers and senior medical experts from abroad, UK and US, Australia. The pre-conference workshop was conducted in 39 departments, in which delegates had ample opportunities to have an hands-on learning. About more than 2,000 delegates from 120 medical colleges from 12 states of India have participated as delegates of this mega event. To sensitize on the eco-friendly lifestyle, we have avoided plastic totally in this conference. I profusely thank Honorable Health Minister for supporting us and encouraging us in conducting this conference. Without his support, we wouldn't have conducted this mega event. I sincerely thank Honorable Justice Sir, High Court for consenting to grace this conference and deliver words of wisdom to the future doctors of India. My sincere thanks to respected Health Secretary Sir and Director of Medical Education for supporting and guiding us in each and every step in this conference. And each and every member of organizing team deserves a special appreciation. I thank all the faculties for accepting our invitation and delivering the great talks. At this juncture, I would like to thank MD NHM, Dr. Arun Tamburaj Sir. Immediately, he accepted our invitation. At the same time, he is supported by sponsoring 10 lakhs from MD NHM, from the NHM fund. And I also thank Dr. Vineet, PDTNHSRB. When we invited him, immediately he also accepted our invitation and he sponsored 10 lakhs rupees from TNHSRB for this conference. Finally, my thanks and best wishes to all the delegates. May you all become a wonderful doctors and serve the society with the dedication, sincerity, and honesty. Thank you, one and all.
Thank you so much, sir. Let us now proceed to light the traditional lamp, a symbol of wisdom, purity, and positivity. ஒவ்வொரு நல்ல தொடக்கத்துக்கும் ஒளியின் அருளும் ஆசியும் தேவை. மதிப்புமிக்க விருந்தினர்களை குத்துவிளக்கு ஏற்றும்படி அழைக்கிறோம்.
Thank you very much, sir. Now it is time to felicitate our chief guests. May I request Dr. A.D. Jagdish Chandra to be felicitated, please, by our Honorable Dean and ADME, Dr. Therani Rajan, sir, and Kavita, ma'am. Our Principal Secretary, Dr. P. Sendil Kumar, to be felicitated. May I request Thangarani ma'am as well as Lata ma'am to kindly felicitate our Principal Secretary, please. Our Director of Medical Education, Dr. Sangamani, sir, to be felicitated. May I request Neya and the scientific team as well as Sunil to come forward, please. Now time to recognize our additional DMB and organizing chairperson, Dr. Therani Rajan, sir. May I request VP ma'am and organizing committee to kindly give a bouquet to sir, please. It will be great if our Dean sir can felicitate our organizing co-chairman, Kavita ma'am, please. Now the most important thing is, when you have a ladder, you should not only see whether you are climbing up the ladder, you should also see whether the ladder is correctly placed in place. And no one can do it much better than someone like a Director of Medical Education. May I request our Director of Medical Education, Sangamani sir, to kindly come forward for his inaugural address, please.
ஜெகதீஷ் என்றால் இந்த உலகத்தை ஆள்பவன், காட் ஆஃப் யூனிவர்ஸ் என்று பொருள். அதே போல் இந்த உலகத்திலே வந்து நம்பர் 1 அதிகாரம் யாருக்குன்னா ஜட்ஜுக்கு இருக்கு. உங்களை வரவேற்கிறேன். அதே மாதிரி சந்திரன் என்றால் நிலவு, நிலவு என்றால் குளிர். நம்மளுக்கு ரொம்ப புழுக்கமாக இருக்கிறப்ப குளிர் போவோம். அதே மாதிரி அவருக்கு பக்கத்தில் போனால் பாசிட்டிவ் வைப்ரேஷன் வரும். அந்த அளவுக்கு ஒரு சிறந்த மனிதர் தான் நமது ஜட்ஜி அவர்கள். அவர்களை வரவேற்கிறேன். அடுத்து வந்து செந்தில்குமார் அவர்கள், நமது செயலர் அவர்கள். கோபத்தின் உச்சி, கண்கள் சிவப்பது. கண்கள் எப்போ சிவக்கும்? கோபத்தின் உச்சி. அதே போல் கைகள் சிவப்பது கொடையின் உச்சி, கால்கள் சிவப்பது நடையின் உச்சி. மனித நேயத்தின் உச்சி யார் என்றால் நமது செயலர் அவர்கள் தான். தரணிராஜனை பற்றி கட்டாயம் சொல்லித்தான் ஆகணும். மகாத்மா காந்தி அடிக்கடி சொல்லுவார், ட்ரூத் கோஞ்சஸ் அண்ட் ட்ரூத், லவ் கோஞ்சஸ் ஆங்கர். எல்லோரையும் நேசிக்க பழகிக்கொள்ள வேண்டும். ஏன்னா இன்னும் 1 மாதம் தான் இருக்குது எனக்கு ரிட்டைர்மெண்ட்டுக்கு. அதனால் நான் தைரியமாக பேசலாம். ஸோ லவ் கோஞ்சஸ் ஆங்கர், எல்லோரையும் நேசிக்க பழகிக்கொண்டால் நிச்சயமாக கோபம் வராது. இப்படி ஒரு கான்ஃபரன்ஸை வந்து அவர் பண்ணது வந்து உண்மையிலேயே பாராட்டத்தக்கது. இப்போ எல்லாருமே ஃபஸ்ட் இயர் வந்துருப்பீங்க. ஃபஸ்ட் இயரில் வந்து அனாட்டமி, ஃபிசியாலஜி, பயோகெமிஸ்ட்ரி மாதிரி ரிசர்ச்சுக்கு ஒரு சப்ஜெக்டாகவே வரணும். உங்களுக்கு எல்லாமே பி வேல்யூ என்ன, அந்த கோசன்ட் என்ன, எல்லாமே ரிசர்ச்சில் வந்து எல்லாமே ரிசர்ச். வி கோட் லாட் ஆஃப் மெட்டீரியல், பொட்டன்ஷியல் நம்மளுக்கு எல்லாமே இருக்குது. ஆனால் நம்ம யூஸ் பண்ண மாட்டேங்கிறோம். அது யூஸ் பண்ணணும். அந்த யூஸ் பண்ணணுங்கிறது தான் தரணிராஜன் வந்து இந்த சிஎம்இயை வந்து நம்ம ஃபஸ்ட் இயர்க்கே வைக்கிறாரு. ஐ அப்ரிசியேட் ஹிம். அடுத்து வந்து லவ் கொஞ்சம் சாங்கர். லவ் கொஞ்சம் சாங்கர், affection and it make the world as a heaven. சொர்க்கத்தை நீங்கள் கொண்டு வரணும்னா லவ் கொண்டு வரணும். அப்போ தான் இம்பார்ட்டன்ட். ஸோ அதை சொல்லி நான் முடிக்கிறேன். வணக்கம்.
Thank you very much, sir. If kindness and gentleness is going to be the mark of a person who is very strong, it would not apply to anyone else other than our Principal Secretary for Health and Family Welfare. May I request our Principal Secretary for Health and Family Welfare, Dr. Sendil Kumar Sir Hayes, to kindly be on the stage, please.
Good morning, everyone. Respected Justice of High Court, Thiru Jagdish Chandra, Honorable Justice Jagdish Chandra, respected Director of Medical Education, respected Additional Director Medical Education, Dr. Kavita, Organizing Co-Chairperson, Senior Deans as well as Professors and Senior Faculty from various medical colleges and students from MMC as well as from all other medical colleges within and outside Tamil Nadu. So good morning to you all. It is indeed a great privilege to be part of this miracle, that is medical interdisciplinary research and academic collaboration for excellence. So indeed, first of all, I would like to thank the organizers, particularly Dr. Terne Rajan, Dr. Kavita and all their team, as well as faculty of MMC for putting in place this conference. This indeed should be continued in the coming years so that there is greater collaboration between institutions, and also it encourages the young minds into what best they can achieve through the medical education. So as pointed out by our additional director, so we have seen continuing medical education programs as well as special conferences for senior doctors, but this is indeed welcome. In fact, though we excel in clinical practices, the medical research has been not good considering the availability of material that is available, especially in government medical institutions. The amount of time we spend in medical research is indeed needs a lot of improvement. So this is not the case at present. Even in earlier times, I have read some British, that is before independence, some of the British doctors also tried to encourage medical research with Indian medical institutions with limited success. So I hope this particular conference will rekindle and also encourage our young undergraduates who are very enthusiastic and very knowledgeable into focusing on medical research, particularly interdisciplinary research, because this medical research as a field has a lot of potential and has a huge market in the future, taking into consideration various challenges that face the humanity. Even during COVID, we have seen how much this virus has affected the entire economy as well as political, as well as economic, social landscape of the world. So similarly, this medical research will really help us to achieve what we have not achieved, what some of the great medical institutions in Western world have achieved. So in this regard, I hope this will be a starting point and make our institutions to give greater focus on medical research apart from continuing to excel in clinical practices. So I once again thank the organizer and also all the participants who have really taken interest to come all the way and spend a few days to listen to some of the best people in the faculty. I once again thank respected Justice for taking our invitation and coming to inaugurate this great event. Thank you. Thank you very much.
Thank you so much, sir. I now request our chief guests to unveil a beautifully curated souvenir that captures the spirit and vision of today's event. இன்றைய நிகழ்வின் நினைவு பதிவாகவும் லட்சியத்தை பிரதிபலிக்கும் அழகான அணிகலனை இப்போது வெளியிடுகிறோம். May I now request our chief guests to release the stamp designed by our own MMC students, which blends the commemoration of 190 years of MMC with the magic of Miracle.
May I request Sunil and the students who designed this, they have this opportunity to be in the inaugural session with a photograph of our chief. Please go.
Audience, please give a huge round of applause, please. Here is the official release of our souvenir and the stamp. Thank you, sir and ma'am. We are privileged to invite our chief guest, Honorable Mr. Justice A.D. Jagdish Chandra, sir, from Madras High Court, to share his inspiring words with us.
Good morning to everyone gathered here. Dr. Sindhil Kumar IAS, Principal Secretary to Government Health and Family Welfare Department, Government of Tamil Nadu. Dr. Sangumani, Director of Medical Education and Research. Dr. Therini Rajan, Organizing Chairperson and Additional Director. Dr. Kavita, Organizing Co-Chairperson. Esteemed faculty members, the student organizers, Sunil and team, respected guests, and above all, the bright and passionate students of Madras Medical College and beyond. Vanakkam. It's an immense pleasure and privilege to be among you at the inauguration of MIRACLE'25, an event that radiates enthusiasm, intellect, and creativity. As someone who spends most of the day deciphering complex case records and legal arguments, reading your conference brochure felt like flipping through a festival of brilliance. With workshops, competitions, scientific sessions and more, this isn't just a conference. It's a celebration of future of healthcare, isn't it? I appreciate the organizing team for coining the term miracle. To be at an institution like Madras Medical College, which predates many modern nations, it's really a privilege. Established in 1835, this college is not just a medical institution, it is a heritage, a beacon, and a living testament to the power of knowledge and service. And looking around at the vibrant energy in this hall, I can confidently say the legacy is not only safe, but ready to soar with minds like you. Miracle is in fact mirroring the evolving face of medicine. The 21st century doctor isn't just someone in a white coat with a stethoscope. They are all data analysts, researchers, communicators, and above all, compassionate caregivers. I noticed artificial intelligence is a part of your workshop, a sign of the times. A decade ago, AI was something from science fiction movies. Today, it's reading X-rays faster than human eyes. But let me assure you, listen carefully, let me assure you, no algorithm can replace a doctor's empathy. No chatbot can understand a mother's anxiety, and no app can hold a patient's trembling hands with reassurance. It might seem unusual to have a judge standing before a gathering of budding doctors, but law and medicine are deeply intertwined. Both professions demand evidence-based decisions. Both deal with life, dignity, and human vulnerability. Both require an unshakable commitment to ethics. Though in a lighter vein, when a doctor says we need to observe the patient, it leads to healing. But when a judge says we need to observe, well, the consequences might not be pleasant. It may lead someone to prison. Yet in both fields, one truth stands tall. Trust is everything. And it must be earned day after day with sincerity, honesty, and compassion. A few words to the future doctors of India. Let me leave you with three thoughts, maybe simple, but perhaps meaningful for your long journey. Stay curious. Medicine evolves every day. New diseases emerge, new treatments arrive. Don't ever stop asking questions. Even the greatest physicians once began with why. Next is stay humble. The human body is complex. There are always more to learn, and remember, humility earns respect not from just peers, but from your patients who treat. Stay compassionate. Patients may forget your diagnosis or the medicine you prescribe, but they will never forget your genuine concern, the way you treated them. I would like to share my few experiences as a patient and a lawyer with the doctors and the medical field. I was once operated for a humerus fracture. The doctor the ortho did a wonderful surgery, but he failed to notice that I was suffering from hyperthyroidism. I was with hyperthyroidism for 2 years until a next doctor whom I met diagnosed, you have been diagnosed with hyperthyroidism for 2 years ago, but did anybody tell you? This is the way. So I request, don't treat your patients like a machine. I was thinking that I was treated like a car, like a AC mechanic who does only the AC job, and a brake mechanic who does only the job of a brake mechanic. So there should be a holistic approach. Don't give up to egos. You say whenever you find something, or if you don't know anything, please ask your senior or your friend who is a specialist in the other field. And other thing is that I remember a case where I don't want to mention the city or the doctor, name of the doctor. He is he's a senior pediatrician in a suburb, in a city near Chennai. What happened was that he was a child, a newborn child was admitted for hyperbilirubinism, but he had entrusted the child with a nurse who did not see the bilirubin level, and it ended up with mental retardation of the child. So don't be overconfident. You also, whenever something is entrusted to you, you see that you put utmost care in that. I will always joke my doctor friends that their signatures are not nice. But now I see your friends who had come to invite me. Their signatures are excellent and they have done a wonderful job. They are artists. They have done the process very well. So I used to tell my friend that once a doctor was found to be a person was found to be a quack. Then the police asked the medical store person, how did you find that he is a quack? And he said that his signature was very clear. So that's how we found out that he is a quack. Sometimes my doctor friends, they used to tease me. So I'm telling you that you must be very, very careful and attentive in everything. So he used to tease lawyers, saying that once a lawyer was cross-examining a doctor who had conducted the autopsy. And he put a question to the doctor saying that when you conducted the postmortem, was the patient alive or dead? So some things happen like, so you must be very, very careful and attentive in what all you do. So let me go. What makes this event so special is that it doesn't stop at science. It is an event where science meets the soul. It embraces creativity, expression, and empathy. Events like Paint Your Thoughts, Photo Voice, and Just a Minute show us the great doctors are also great storytellers, artists, and visionaries. It's heartening to see that MIRACLE'25 is shaping not just capable doctors, but also compassionate leaders, critical thinkers, change makers, and administrators. Administrators like two of your doctor friends who were supposed to have come, Mr. Arvind and Mr. Dr. Vineet and Dr. Arun Tambaraj. They are all good doctors turned administrators. I also see a lot of administrators in you. So I was just speaking to one of our health secretaries and his son, who is a doctor who has been selected to IAS now. And somebody had asked him why you prefer your son to be an administrator. He said that if he is a doctor, he will be able to treat thousands, but he is becoming an administrator, he will be able to take care of lakhs of people. So you must be thinking of that also. So I congratulate the faculty and organizers for nurturing such a vibrant platform, and I wish the students that you may carry forward the spirit into your careers. The white coat is not an uniform. Listen, the white coat is not just a uniform. It is a promise to treat with both skill and the heart. In the words of the great physician, Sir William Osler, the good physician treats the disease. The great physician treats the patient who has the disease. Once again, I wish Miracle 25 every success. I'm sure these events mark the beginning of many such milestones on your journey to excellence. God bless you. Thank you all. Vanakkam.
Thank you very much for the wonderful words of wisdom, sir. The differences you said, in spite of having an artificial intelligence, the importance of a doctor touching a patient, and the difference between observance of two people. Yes, sir. Please.
I must tell about Arun Tambaraj who joined lately. He was selected for IPS. And what happened was he wanted to become, his father is already a police officer, he wanted to join as an IAS. And he argued his case before the Supreme Court on his own. So he is also a lawyer who argued his case before the Supreme Court. I wish him all success. Yes.
Thank you. Thank you very much, sir. Thank you. Thank you. We are coming now to the close of this session. இந்த நிகழ்வை வெற்றிகரமாக நடத்த உதவிய அனைவருக்கும் நன்றி தெரிவிக்க, to express our heartfelt gratitude to all who made this event possible, we invite our Vice Principal Ma'am and Organizing Co-Chairman Dr. M. Kavita on stage, please.
A very good morning to one and all present here. Respected Justice Dr. Jagdish Chandra sir, sorry, Mr. Mandar and Dr. Sendil Kumar sir, IAS, Dr. Arun Tambaraj sir. There are so many administrators turned doctors and doctors turned administrators. I'm just confused. The Director of Medical Education, Dr. J. Sangamani sir, Dr. E. Therani Rajan sir, Additional Director of Medical Education, all senior directors of Madras Medical College, the faculties who have come here as speakers, the students of other medical colleges, the students of Madras Medical College. I stand here with great pride and emotions. It's a privilege and it's a prestige to give the vote of thanks for this event, which is one in the history of India where undergraduates are first time we are conducting this national conference with renowned speakers from national level as well as at the international level. And it is also of the interdisciplinary level where we have invited ministers, secretaries, and judges who are sharing with you how collaborated we have to work together to address the healthcare healthcare system of India. So here first I would like to thank our Honorable Chief Minister who had sent us a message which has been put up in our venue as well as in the Souvenir. So with the blessings of God, we have continued this journey for the past 2 months. When we initiated this program, the name was given by one of our own students after we conducted a competition like with 110 entries of names, of which Miracle was shortlisted. This word miracle has really been a miracle to conduct this event, which went through so many, each event which we did was with great efforts and combined efforts, collaborated with the students and the faculties that we have done this program. There has been many night works that our students have undertaken. The students from first year to house surgeon have been collaborating to do this work. And our Dean, Dr. Therani Rajan sir, it was his brainchild that event should be conducted. He had asked me to do this for 3 years back, but the time has come now only, when all of us have come together. Sir has invited and spoke to each one of your administrators, the deans, vice principals, and the MAU coordinators to send you all here with full attendance on OD. And I thank sir for bringing in this amount of response from all of you. And without our DME sir's coordination, this would not have been possible. He had stood with us and supported us throughout. Our health secretary was always with us in conducting this program, and I thank you, sir, for being with us and guiding us to conduct this program today. Our Justice Jagdish Chandra sir has been so positive and powerful, as DME sir said. He had guided all our students. He had appreciated us during our visits to him when we invited him. And he was such a positive role. And we are very happy to have you here, sir. And there has been a lot of love, affection, kindness throughout wherever we met, whomever we saw. All the speakers that we contacted had been very generous enough to be here with us. And each one of them have kept you upgrading all your skills. I'm sure they have been very inspiring to take up many professions because they had inspired you on this day. All of them have shared their knowledge to the best with their experiences, and many of them had given a very good feedback on day one with all the speakers who had interacted with you. And all the sessions were very interactive. The questions were asked at the end. I would like to have a special thanks to the comparing team who's been with us, Dr. Chengalvarayan, Dr. Shakti Sri, and in Hall B also, Dr. Meera and the team. We had divided so many teams who had worked collaboratively. The scientific team, I may not be mentioning all the teams, please do not mistake me. The scientific committee team under Dr. Hemanandini Madam, the accommodation committee, the food committee, the hall arrangements committee, the finance committee, and so many other committees which has been working together, and the students along. I will be failing in my duty if I don't mention Dr. Not doctor, our students, the secretaries, Sunil and Neha, who had been working from day one, along with their team of people. A special mention of Hari Prakash, who has been doing all the video and audio things, that all the posters that you would have seen of all the speakers was done by him and his team. And so many are there in the team. I'm just mentioning a few names so that we also had Vishal, Kushi, and so on. So many. I would like to thank specially the culturals team who had taken up the concept culturals and given you a feast. Many of you had appreciated that yesterday, and now also today also we'll be giving you some of these events. The list goes on and on. I may have left some, but still, my heartfelt thanks and gratitude to each one of you who has been with us in coordinating with all of them. I thank each and every one. And of course, sir would not like it, but I would like to make a special mention of Dr. Arun Tamburaj sir and Dr. Vinit sir, who had been with us and supported us financially with 10 lakhs each. Thank you, sir. So, I like to thank each and every one of the delegates who has come here and who has been with us, maintaining all the decorum. Thank you all. Once again, I thank each and every one. I'm sorry if I have left anyone. It is not with any intention. Thank you all.
Thank you so much, sir, for being here.
Thank you, everyone. Just stay on because we are going to have the next presentation. Our community medicine professor is waiting for quite some time. We'll have the next presentation to start now. Your official tea break will be after this presentation.
AV team, please make ready the PPT of Dr. BVC Satyasekaran sir. AV team ready? Is the AV team ready? We are now moving on to our next academic session by Dr. BWC Satyasekaran sir, who will be talking on epidemiology and clinical practice. Sir is currently the Dean of Research in Sri Balaji Medical College and Hospital, Chennai. Sir has about 50 years of teaching experience in community medicine and epidemiology. Sir has served as Member Secretary for the Institutional Ethics Committee and as Chairman for the Institutional Committee for Stem Cell Research and Therapy at Sri Ramachandra Institute of Higher Education, Chennai. Sir has conducted several workshops in epidemiology for medical students. Over to you, sir.
Good morning. Thanks for inviting me to be a speaker today. I'll be discussing with you the topic on, as you can see from the screen, the topic on epidemiology and clinical practice. Under the following headings, what are the basic concepts of epidemiology? What are the basic concepts of clinical practice? Application of epidemiology in the day-to-day clinical practice. And lastly, what is clinical epidemiology? What is epidemiology? Epidemiology is the study of variations. If someone asks you, what is epidemiology? You can tell them, epidemiology is the study of variations in the, I'm sorry, how do you go back? Epidemiology study of variations in the occurrence of disease and why such variations should occur. You take many diseases, you find them, they occur in, you find variations in their occurrence. Some disease occurs among children. Some of them predominantly occur in older age group. Some of them occur in males, some of them in females, and also some of them occur in particular occupational exposure. So when you try to find out why these variations occur in the occurrence of diseases, you'll be able to understand, hypothesize the possible underlying mechanism of the causation of that particular disease. I'm going to change the slide to the next one, and only if you carefully observe, probably you've done it earlier, you'll be able to see one small change in the word. Epidemiology is also the study of variations in the outcome of disease and why such variations should occur. You take any disease, give the standard best treatment possible. Still you find some of them going for complications. Some of them going for, even some of them may die, and some of them completely recover. So you find that the outcome of disease is also variable. If you carefully observe why this variation occurs in the outcome of disease, you'll be able to understand in improving, innovating diagnostic methods or innovating newer treatment options. And this is probably the basis for the clinical epidemiology. Epidemiology is concerned with populations rather than individuals. Though the results of the applications, the principles of epidemiology can be applied at individual level, per se, epidemiology is concerned always with groups of people, with populations than individuals. The next slide is important. I would like every one of you to remember that. Epidemiology includes any health-related research involving human participants. Epidemiology is like a big umbrella. It includes any, or it includes all health-related research. If you can use a word where human beings are used as study subjects. We avoid that word study subjects and used on study subjects. So instead we are using the word involving human participants. That is any human research. It doesn't include any animal research. Let me repeat again, epidemiology includes any, or for that matter, all health-related research where human beings are involved as the study participants. And it may be a genetic study, it may be a clinical research, or it may be a population-based study, it may be anything. It may be a clinical economic study, anything. But wherever human beings are used or involved as study participants, it comes under the broad umbrella of epidemiology. I would like everyone to remember this, keep this in mind. I would like to give some examples of health-related research involving human participants. There are many examples, but I will just give a few of them. Prevalence of disease in a population. For example, you study about the prevalence of hypertension in a given population by a cross-section study, and that is an example of health-related research involving human participants. Or it may be you want to know the incidence of a particular disease. For example, incidence of measles in childhood population in a particular place by cohort study or by longitudinal study or even by surveillance. That again comes as an example of health-related research involving human participants. Evaluation of association between risk factor and disease. There are any number of diseases that we have, and many factors or many variables are suspected to be risk factors for that particular disease. For example, sedentary lifestyle is one of the risk factors for non-alcoholic liver disease, fatty liver. And this can be evaluated. The association can be evaluated or put a number to that using case control study or cohort study. Again, it's an example of health-related research involving human participants. What about diagnostic tests? There are so many diagnostic tests which are coming up, new ones are coming up, and we have to evaluate the test characteristics compared to the gold standard, or if not available, a standard reference test which is already in practice. And for example, evaluation of saliva samples compared to the throat and nasopharyngeal swab for lab diagnosis of COVID-19, for example. And it could be done. It was done by diagnostic accuracy cross-section study method. Again, it's an example of whenever you evaluate a diagnostic test, it's an example of health-related research involving human participants. And what about even this evaluation of any intervention, any treatment, any surgical procedure. For that matter, someone wanted to evaluate dexamethasone and antibiotics combination for the treatment of pleural effusion compared to antibiotics alone by a randomized control trial. Though it comes under clinical research, it also comes under the broad umbrella of epidemiology. So what is epidemiology? We know that epidemiology is the study of variations in the occurrence of disease and also study of variations in the outcome of disease, trying to find out why these variations should occur. And remember that epidemiology, it includes all research, health-related research, where human beings are, if I can use the word, used as study subjects, or where the humans are the participants for research. It doesn't include animal studies, it doesn't include other studies, because epidemiology is concerned with people, epidemiology. With this background, now let us look into what is clinical practice. Clinical practice can be explained in different ways. You can write pages and pages trying to explain what is clinical practice. But I'm going to only tell about 2 points as a basic concept for clinical practice. Clinical practice involves direct patient care. You may be a physician, you may be a surgeon, you may be a specialist, you may be any person. But clinical practice means that involves direct patient care. And it also is, there's a kind of a doctor-patient one-to-one relationship. It is a contract, maybe an unwritten contract between you and the patient, governed by the ethical principles of clinical practice, and also maybe governed by some rules and regulations. We talked about epidemiology as something concerned with populations and not with individuals. Just the opposite. You may be treating many patients, doesn't matter, okay, good. But still, clinical practice means it is one-to-one relationship, a relationship between the doctor and the patient when you give care for the patient. It may include many things. I couldn't include everything in the slide. There are a few examples like this. History taking is a part of clinical practice. Eliciting signs and symptoms, clinical examination, making provisional diagnosis, asking for confirmatory diagnostic tests, confirming the diagnosis, giving treatment, management, disease prevention, health education, counseling, and maybe the list can go on forever. Anything involving patient care comes under clinical practice. The question now is, clinical practice should be what? Clinical practice should be evidence-based practice. I'm sure all of you will agree with me. Clinical practice should be evidence-based practice. When you elicit sign or symptom, when you ask for a diagnostic test, when you give treatment, everything, any aspect of clinical practice should be evidence-based, because we are based on scientific facts. Again, the question is, where do you get this evidence? Clinical practice should be evidence-based, but where do you get the evidence? Evidence is obtained from, you may be knowing the answer, evidence is obtained from epidemiological studies. I gave you some examples of epidemiological studies, health-related research involving human participants, and all the evidence in my day-to-day clinical practice comes from that. And we don't depend on, of course, the animal studies are very important, lab-oriented studies are very important, but when it comes to clinical practice, we don't just take up the results of animal studies. In clinical practice, we always depend upon the evidence that comes from health-related research involving human participants, that is human studies. I'll just give some examples about how epidemiology, the health-related research involving human participants, the evidence from these types of epidemiological studies, how they are useful, how they are applicable in day-to-day clinical practice with some examples. That's a question. 70-year male complaining of chest pain. 17-year female child complaining of chest pain. Almost similar kind of chest pain they are complaining about. For whom you will suspect coronary heart disease? Very simple question. I'm sure even undergraduates who have started their first year or second year will be able to answer this question. I'm sure the answer you have in mind is definitely it is 70-year male complaining of chest pain. Though similar chest pain is complained by another age group from a child. You don't think about that. Why? Because you know the prevalence of CHT is high in elderly males. Done by, you may say that, where do you get this information, the prevalence of the CHT? You may say that it's from a clinical experience. Good, well and good, it's very important. But mostly we get quantifiable information about prevalence of different diseases by cross-sectional studies or prevalence studies done in populations. And this information, the pre-test probability, is very useful to suspect, to start with, probable presence of a particular disease. So you find that the epidemiological studies, the principles and methods, the results of that, you find them useful in your day-to-day practice. Another question, simple question. Patient has hypertension. You are doing a clinical practice, there's a patient coming to you with hypertension. What important dietary restriction you would advise? I'm sure all of you know the answer. Even people who are not in the medical field may know this answer. I'm just making it simple. The answer is salt restriction less than 5 grams per day. But how do you give this advice? Where is the evidence? For a day-to-day clinical practice, how can you make this statement? It is from studies done earlier, like using case control study design or cohort study designs, where they proved that higher levels of salt intake is an independent risk factor for hypertension. And this is another example of where clinical practice you are depending on the epidemiology. Between X-ray and ultrasound, which you will prefer as diagnostic test for gallstone? Again, very simple question. Everyone knows the answer. You will prefer ultrasound because it has got much more sensitivity than X-ray for diagnosing gallstone. But where is the evidence? How can you make this statement? How can you make this preference in your clinical practice? Definitely based on studies done earlier. That is, you have this kind of a diagnostic accuracy cross-sectional studies or diagnostic accuracy case control studies. Study has been done for many years ago between ultrasound X-ray, and they found out that definitely ultrasound's got better test characteristics in terms of sensitivity. Last but one question. Delayed or early clamping of umbilical cord is better in reducing anemia in infants at high risk of iron deficiency anemia. Suppose you are an obstetrician practicing in a place, in a population where iron deficiency anemia in infants, small children, below 1 year, you find them high. The question here is whether you'll do delayed clamping of umbilical cord when you deliver a child, or you will do early clamping. The answer is delayed clamping of umbilical cord is found to be better. But how do you do this practice? How do you do this clinical practice in your obstetric care? Because randomized controlled trials done earlier have proved that definitely delayed clamping of umbilical cord is better in reducing the risk of iron deficiency anemia in infants. Again, you find a clinical research which comes under the umbrella of epidemiology. You are using it in your day-to-day clinical practice. Last question, last example. A head injury patient was brought to the emergency department. Glaxocoma scale for the patient was found to be less than 8. The family members are there. The relatives are there. They're asking you if my son or daughter or wife or husband with his head injury will survive or not? You have to answer. Based on this, scale of below 8, your answer is going to be, the prognosis is going to be very, very, very bad, very poor prognosis. But how can you make this statement to the relatives, telling that the person may not survive, kind of thing? Because many years ago, people had done studies using the inception cohort study method, and also building up something called a predictive modeling, and they were able to build up the score, very famous one. And based on that, it is epidemiological study. Based on that, you are doing in your clinical practice, you are making those kinds of predictions. So epidemiology has many applications in clinical practice. There are hundreds of examples with knowing or even without knowing, clinical practice, you are using them. Epidemiology has many applications in day-to-day clinical practice. There's one entity called specialty called clinical epidemiology, which is a separate specialty in some of the other countries, though I think it's only started here in India recently, not very popular here. What is clinical epidemiology? Clinical epidemiology is an application of epidemiological principles and methods, what they are, to problems encountered in clinical medicine. As you practice, you come across many challenges. You come across many issues. This can be studied by using the methods in epidemiology, by using the principles of epidemiology, and then you may be able to find out, some solutions, like we're evaluating diagnostic tests, even RCTs, or even case control cohort study designs. And let me repeat it again. Clinical epidemiology is application of epidemiological principles and methods to problems encountered in clinical medicine. This will be my last slide. Probably this was my first slide also. What are the basic concepts of epidemiology? Remember that epidemiology is basically study of variations in the occurrence of disease, and also study of variations in the outcome of disease, and try to find out why these variations occurs. Thereby you are able to understand the causal mechanism of disease, and also you will be able to improve your clinical practice methods. What are the basic concepts of clinical practice? You know that it is one-to-one doctor-patient relationship, and we will be doing so many things during clinical practice, and main important thing is clinical practice should be evidence-based practice. Only based on evidence available at the present moment, at the present knowledge, we do clinical practice. And the evidence comes from epidemiological studies, health-related research involving human participants. And lastly, clinical epidemiology is very useful as a specialty where you can also do something called clinical economics studies. You can do predictive modeling. You can also evaluate various diagnostic tests, and there are many applications. And the challenges, the issues we face during clinical practice being studied and taken care by the methods, by the specialty called clinical epidemiology. Thank you.
Thank you so much, sir. May I ask the audience questions now? So how can epidemiological data be better integrated into primary clinical decision making to improve population health outcomes at the community level?
Good, very tricky question, but the answer is very simple. The health of the population based on health of individuals. Epidemiology per se, involves population studies. And as I was telling you, though predominantly it's population-based, the results are applicable to individuals. And the care of the individuals, when you do clinical practice, I've given you some examples. There are many examples available. And epidemiology is used. Think about epidemiology as a broad umbrella, which includes all health-related research involving human participants. We cannot think about animal studies in this, animal research in this, but human studies. And since we find epidemiology, evidence from epidemiology and day-to-day practice goes together, definitely improving the individual health is going to have better outcome on the population. And also the population studies we do by epidemiological methods definitely has applications at individual level also. They go together. You cannot separate the population made of individuals and individual contribute to population health.
One last question, sir. In what ways can community-based interventions informed by epidemiological research reduce the burden of non-communicable diseases in underserved populations?
Okay, very complicated question, but the answer is again simple. Let it be non-communicable disease. We also went through some examples of non-communicable disease. Let it be communicable disease. Let it be a population which is deprived of access to health, or population which is having a lot of access, good access. But for everything is studied individually by methods in epidemiology. And definitely, whether it is a non-communicable or communicable disease, the yardsticks are same in the sense that the way it is studied are same. The way the methods in epidemiology are applicable both communicable and non-communicable disease. And also, whether even in remote areas, probably epidemiological studies are has got more thrust areas in remote and difficult populations. And I think the answer is that whether it's communicable or non-communicable disease, whether it is difficult terrain or not, the clinical practice will be based on evidence-based practice, will be based on evidence, and that evidence definitely comes from epidemiology. And definitely epidemiological studies have a direct impact on the healthcare system, health delivery system also.
Thank you so much for providing clarity over integration of epidemiology and clinical practice, sir. I may now request Dr. Sendil Kumar, sir, Professor of Community Medicine, to felicitate Dr. Satyasekharan, sir. A huge round of applause, please. Thank you, sir. We may now break for tea. I request all of you to be back to the session within 10 minutes.
as we are waiting for our Honorable Health Minister to arrive, I think we'll have one session in between. If Dr. Geeta Arjun Madam is ready, we can have one session, your session in between, ma'am, please. Madam has received a G.V. James Prize in Surgery, Rukmani Gold Medal in Obstetrics and Gynecology, lectures and orations in India and abroad, both for the medical fraternity and for the lay public. She'd been organizing secretary for the Progress series of conferences from 1993 to 2017 and authored Management of Labor, editor for the third and fourth editions, and a practical guide to obstetrics, edited the first edition and authored the second edition, and Essentials of Obstetrics. May I request Dr. Geeta Arjun ma'am, the currently director of E.V. Kalyani Medical Foundation, to kindly be on stage, please.
Thank you. I am just an intermittent session before the health minister arrives. So good morning to all of you as soon as my slides come on. Good morning to all of you. I'm totally delighted to be here. For all the MMCNs, I joined Madras Medical College when I was 16 years and 3 months old, and then finished when I was 23. So 50 years later, it's a great honor to be here. If I can have my slides, please. And also, it was such a delight to see all the babies whom I have delivered, so many of the babies whom I have delivered, actually being part of the audience, and it's absolutely an honor to be here. So, when he announced that I had got those gold medals, he forgot to mention that though I did not get the Johnston Gold Medal for the best outgoing student from my class, I did manage to get the Johnston Gold Medalist. Arjun has been my best friend for the past 54 years. And this year, we celebrated our golden 50th anniversary. So it's in so many ways, on so many levels, this has been amazing. Right. Every day people wake up around the globe asking themselves, how can I have an impact on human beings? How can I make a change in the world? What can I do? And all of you, the future of healthcare in India, all of you are so blessed because every day somebody comes and asks you for help. And every day you are able to solve a problem. Do not even worry about AI. Do not worry about it because humanity is what's going to win. And the first thing to do, and these are 3 very important nuggets that I have learned over several years of decades of practice, ask the person who is in front of you. And ask with concern, true concern, be interested. Listen, because seniors might tell you, oh, if you ask them to start talking, they will talk and talk and talk. No, studies have shown, RCTs have shown, that most people will talk only for 2 minutes and then they will stop. So listen, and listen with empathy. Lean towards them, make eye contact, because that connects you with that person. And most importantly, act. And act with compassion. That's what will make you the most successful doctor ever, okay? And that's where it's important. My favorite poet, Maya Angelou, said, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. If you made them feel seen, if you made them feel heard, if you made them feel supported, they will forgive you when some things go wrong, because in medicine, guaranteed things can go wrong. When a child falls down and hurts itself and starts crying, intuitively the mother will comfort the child, hug it and kiss it. When a man walks into your ER with severe flank pain radiating to the groin, immediate diagnosis, ureteric colic, and out comes the medication and you give him because you cannot let a man suffer. I mean, he's got ureteric colic. But when it comes to a woman who comes to you in labor, questions are thrown at her. Why are you screaming? We didn't ask you to get pregnant. I mean, listen, most women don't have the choice. In our country, most women don't have the choice of when or where they want to get pregnant. And then they ask this question, you can't even put up with this amount of pain? And this always horrifies me. You know why? Because how painful are labor pains? And I don't want to scare the young ladies in the audience, but it is ranked amongst the most intense pains a person can experience. Person, man or woman, most intense pain that a human being can feel. It's been said that it feels like broken bones. It feels like a severe ureteric colic with a huge stone blocking the ureter. But remember that the woman has to put up with it for hours. And she cannot say, okay, you know what, I'm taking a break, let's stop the pain, and then we'll start labor again tomorrow. No, it won't happen. Why are women treated with disrespect? Is it patriarchy? Is it because no man has ever felt a labor pain? And let me tell you, if men ever had to have labor pains, the human race would have been eliminated on this planet many, many, many millennia ago, okay? So is it because men don't feel this pain? And is it because they feel, oh, it's such a common thing. Any woman who gets pregnant is going to go into labor, so why is she complaining? But what worries me most is why do women disrespect women in labor? Women who have had babies, women whose daughters have gone through labor pains, women who have seen their sisters scream in pain. Why are these caregivers, who are women, nurses, doctors, attendants in the labor room, why do they treat them with disrespect? Dr. Varun Patel, for a short while, became very infamous because in 2013, in a blog he wrote that in an Indian government hospital, giving birth to a child is not a unit less than suffering third-degree torture in jails. And he wasn't talking about labor pains. He was talking about the treatment meted out to these women who are at the highest risk for being abused. I mean, remember, this abuse in labor goes on around the world, but it is much more common in lower and middle income countries like ours. The poor and the most vulnerable, women who cannot stake a claim to their rights. They don't know that they have rights to good treatment. Women who do not know their entitlements. Women who are not married to ministers or who are married to rich people. They don't have anybody to turn to, sorry. Adolescent girls, young things who got pregnant not because they wanted to, but just because they were married off early, got pregnant. Unmarried women come in with the stigma attached to them. Women from scheduled castes and tribes. Migrant women who don't even speak the language in the state that they are stuck in. Women are now finding their voices. And it's time we started listening to them.
I demand to be treated with respect.
And it's time we started listening to them and giving them respectful obstetric care. In 2018, WHO came out with recommendations for intrapartum care for a positive childbirth experience. They said it's not enough for a woman to say that the woman survived. Oh, you know what, she had labor, but you know what, it's great, she didn't die. Hello, we are not here to say that she didn't die and so therefore it's been a successful labor. They should have a sense of control through involvement in decision making and which leaves them with a sense of personal achievement. You all sit in cricket stadiums, one silly fellow hits a sixer, the whole 20,000 people are up and cheering. Why not for this woman who went through one of the worst pains she's ever felt? We as a team of caregivers should be cheering her on, giving her comfort, telling her that she's doing a great job. A basic human right to receive childbirth experience, it involves several elements. One is, it should be a positive experience. She should be reassured that she has come to you and you're taking her life and her child's life very seriously, and that you're working very hard to make it the best experience in her life. That's what we used to do. In our hospital, every time a woman left, we asked her, how did you feel during this labor? Did you feel supported? Because you have to learn from the women who are under our care. It should be evidence-based. We heard Dr. Satyasekaran speak this morning. It should be data-backed. Any intervention, any medication, any procedure that you're doing for this person should be data-backed. And that I am very proud of for the 30-odd years that I practiced as a physician. We always practiced data-based, data-backed, evidence-based medicine. It should be equitable. It doesn't matter whose wife she is. She could be an auto rickshaw person's wife. She could be the wife of a CEO. But the care that is given should be universally equal, equitable, right? It should be respectful. Let's not forget to give the woman, to understand that the woman has dignity, and we have to maintain that dignity through an extremely horrifying, undignified process, which is childbirth. And caring. This is so important, because if you acknowledge their humanity, then you are demonstrating your own humanity as a physician. And never, ever forget that. Whoever you're treating, the person who cannot afford your fees, don't ask them, how much can you pay before I will treat you? And the person who can buy your hospital. It doesn't matter who it is, but you have to show them your humanity. And as I said, evidence-based care, there is a lot of no-do gap. And what do I mean by that? Knowledge, your book knowledge, does not translate into quality of care. In our practice, every year, everything, when protocols changed, evidence came in, we changed our protocols in our hospital. All of us sat together and said, this is what we are going to do. This is how we are going to start changing treatment, because every year something or the other new knowledge comes in, and we must be able to translate that medical knowledge, clinical, epidemiological knowledge, to quality of care. Everybody talks about dying with dignity. How about laboring with dignity? Nobody talks about that. Everybody is just like, oh, she's come for a baby, stop screaming, let's just get on with it. And the caregiver's authority and decisions take over. And the poor woman she's stripped of autonomy in the labor room. She cannot ask, she cannot question. And the answer, at least in Tamil, they say, "Yanak terima, wanak terima, mujhe malum hai kya, tumhe malum hai." So it is always, like, I am God. We are not gods. We are just doing good work. And I think it's important to remember that. In 2017, the government of India brought in Lakshya, labor room quality improvement initiatives, because they understood that women need respect in the labor room. And such a certification has gone around in many, many hospitals, and it's such a great improvement. We must remember that there are two Indias. One India where you have the wherewithal to get the best, and you will receive the best, not necessarily always compassion and caring, but at least in terms of what surrounds you. You may have that. You may not get evidence-based medicine, but you will get good, a room, all the equipment, all the devices. And then there is this India where two women have to share a bed. And this is the reality of India. We cannot forget this dichotomy. There is an India where every caregiver will be smiling at you because you have the money to pay them. And then there is the underpaid, overworked staff in hospitals, public facilities, where they are having to do so many things and being yelled at by the superiors because they didn't do what they were supposed to do. Substandard of quality of care results in maternal morbidity and mortality. This has been well established, and this includes disrespectful and abusive behavior in the labor room. Let's hear their voices. These are available on public platforms. This is not something that I made up. Physical abuse, there are 7 things which have been outlined as abuses or abusive behavior. I lay there as quietly as possible, too scared to make a noise because then the nurse shouted at me and slapped me. Non-consented care. For cesarean section, they only take signatures from the husband. All he did was impregnate her. He didn't go through the 9 months of labor. Ask her, get her permission. Non-confidential care. They expose you, they shave you, they leave you alone won't allow your relatives to be with you. From 1981, in my hospital, the husbands were allowed in the labor room. Now, in public facilities, obviously, they may not be allowed to get a male in because there are so many other women there, but it is important to have the husband in there. They injected without explaining. Every word that came out of her mouth was about the color of my skin, discrimination. You just call and call until you get tired, and then you finally deliver by yourself and die. Abandonment of care. And worst part, you have not paid, so we will not discharge you. These are the 7 things that they talk about. So government hospitals say, why do you blame us? This is something that I want to share with you with a hospital in Aurangabad. A lot of hospitals in Chennai also are doing all this.
In response, hospitals blame overcrowding, inadequate infrastructure, staff shortages, poor pay, and work stress. Given these constraints, can health facilities be committed to providing respectful maternity care? Here's an example of a hospital with a difference. The Government Medical College in Aurangabad, which sees between 50 to 60 deliveries every day. Last year, over 17,500 deliveries were conducted at the hospital. At the outpatient department for pregnant women, there are no queues, no chaos.
उधर जाकर भोजन करने का.
There's music playing in the labor room, a birth companion to comfort the pregnant woman, and curtains to ensure her privacy. Birth companions are trained by a doctor to look out for danger signs in the expectant mother and help patients when nurses are busy.
These documentaries have been brought out by White Ribbon Alliance, which is a global association which concentrates on maternal abuse in labor. So we have to change the culture. And this is not specific to anybody who is in the audience. All audience members are accepted in this, okay? The change has to come from the top. What happens is there is a person, senior person, who then says, this didn't happen. The next assistant says, I really don't know, I'm very confused. And then the postgraduate gets yelled at. The senior surgeon gets yelled at by her. And then ultimately, the final year medical student says, I really don't know what to do. And the person who takes the brunt of this is the woman who has had a baby or is going through labor. So for this, sensitivity training has to start in medical college, and communication skills are extremely important. Remember, the labor room should be a sanctuary, not a torture chamber. If I send you off with just one message, remember that the currency that you will be dealing with is not rupees and paise. The currency you will be dealing with is kindness. The more you give, the more it grows. Thank you very much. I do want to thank Dr. Kavita, the Vice Principal, and Dr. Therani Rajan, who was, I think, one of the finest deans this Madras Medical College has ever seen. Thank you very much.
Audience questions. How can healthcare providers ensure informed consent and autonomy are upheld during labor and delivery?
So there are rules for this, that you may not necessarily always have time to get a signed consent, a written consent, but if you talk to the person, the verbal consent is accepted in certain situations, but you don't have to get a written consent to do a pelvic examination or any intervention like a forceps. You don't necessarily have to have a written consent, but you have to discuss it with her, and if she has a birth companion with her, they should also understand what you're going to do. So you have to explain that. And this can be possible in the busiest of labor rooms. Talking, 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 talking. I have never been sued in my 30 plus years of practice. I never had a case go to court because we believed that even when things went wrong, you don't hide anything, you explain. You don't go say, I'm sorry, I'm sorry. You say, no, this is what happened. And then you explain and they will forgive you.
One last question, ma'am. In what ways can healthcare systems monitor and address violations of respectful maternity care?
Oh, I think it has to come from the top. I think the person who's in charge of the institution has to go after anybody who is unkind. One of my friends said, not friends, an acquaintance went to a government hospital, OBGYN hospital, and when she said, can I know your name? They said, why do I need to give your name? No, introduce yourself with a smile, give your name. They're not going to come after you because of the name. You know why violence is happening? Because people are feeling cheated. People are feeling as if they are being betrayed, that they are not being given good care. So introduce yourself. You don't have to give your full name and address, obviously. But if you just say, hey, you know what, I'm Dr. Meena, I am going to take care of you. That's all, one little thing. So it has to come from the top. Everybody has to invest, has to get into this kindness, this whole ethos of kindness. And that's what we did in our hospital. Everybody smiled. Every caretaker, from the person who swept the bathrooms to the person who did the surgery, smiled and talked and communicated. Thank you very much.
Thank you so much for throwing light on respectful maternity care, ma'am. There's a question from the audience.
Yeah. So women are underrepresented in clinical research across the globe, but also the problem is that now we are seeing only the last names on papers, and we don't realize that a lot of them are women, especially in OBGYN. Okay? Even our book is called Seshadri and Arjun. So my husband and Lakshmi's husband get all the credit, but they don't realize that it is actually women who have written it. But to answer your question, to get to the point, what can you do? Practice evidence-based medicine every day. Go back and... My consulting room had all the textbooks there. So if a woman had a question, I would say, you know what, can you wait for 10 minutes? So somebody comes with, we used to deal with very high-risk pregnancies, comes with a syndrome we have never seen. We look it up and then talk to them. Yeah, so it has to be from within. Nobody can do it for you. You have to say, I am a woman, so what? I am a doctor, and I will do the best.
Hope your doubt is clear. Thank you so much, ma'am. I may now request Professor Dr. Kuppalakshmi, ma'am, Professor of Obstetrics and Gynecology, to felicitate Dr. Geeta Arjun, ma'am.
Dear delegates and students, our Honorable Health Minister has arrived. So we are just waiting to felicitate him with a small dance show here. This will be followed by a felicitation by our Health Minister and prize distribution also. May we welcome our Honorable Health Minister with the Bharatanatyam show, please.
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
Ta jum num ta jum ta dhalam ku tak te ko da de tang de de da jum ta ka jum ta ta ki ta da ta jum de jum ta ta num ta jum ta ki ta da de tang de da ta ni ta dan ta dun ta din ta da jum ta num ta rum ta ga din ta ki de da dim ta da jum dim da jum nam da jum tam ta kita da na ta tang dim ta jum dim da kita jum da kita da jum da kita da jum kita jum da kita ta jum dim da jum nam da kita jum ta dim tum nam ta tang kita
Thank you for an excellent performance. Just give us a minute to rearrange the chairs, please. May I now request the dignitaries on the dais, please. நமது மாண்புமிகு மக்கள் நல்வாழ்வு மற்றும் சுகாதாரத்துறை அமைச்சர், our Honorable Minister for Health and Family Welfare, திரு மா சுப்பிரமணியம், on stage, please. Our Principal Secretary to the Government, Health and Family Welfare, Dr. P. Sendil Kumar, IAS, on stage, please. Dr. A. Arun Tamburaj, IAS, Mission Director, National Health Mission, on stage, please. Dr. E. Therani Rajan, our organizing chairperson, on stage, as well as Dr. M. Kavita, organizing co-chairperson. I may request Dr. Gopalakrishnan sir also to be on stage, please. Gopalakrishnan sir, please. May I request Therani Rajan sir to kindly give the welcome address, please.
அனைவருக்கும் என்னுடைய முற்பகல் வணக்கத்தினை சிரம் தாழ்ந்து உங்கள் அனைவருக்கும் செலுத்துவதிலே மிகுந்த மகிழ்ச்சி அடைகின்றேன். வருகை புரிந்துள்ள மாண்புமிகு மக்கள் நல்வாழ்வுத்துறை அமைச்சர் அவர்கள் இந்த மாநாட்டிற்கு வர வேண்டும் என்கின்ற எங்களுடைய அவாவினையும், மாநாடு நடத்துவதற்கான பர்மிஷனை நாங்கள் எங்களுடைய மாணவ கவுன்சிலுடன் சென்று அணுகிய போது எந்த ஒரு நொடியும் யோசிக்காமல் உடனடியாக எங்களுக்கு இந்த அனுமதியினை ஏப்ரல் மாதத்திற்கு முன்பாக மார்ச் மாதம் 23ஆம் தேதி என்று எங்களுக்கு வழங்கினார்கள். அவர்கள் வழங்கவில்லை என்றால் இந்த அளவிற்கு இந்த மாநாடு தேசிய அளவில் முதன்முறையாக தமிழகத்திலே இதனை முன்னெடுத்ததற்காக எங்களுடைய குழுவின் சார்பாக, ஆர்கனைசேஷன் டீமின் சார்பாக என்னுடைய நெஞ்சார்ந்த மனமோந்த நன்றிகளை அவர்களுக்கு தெரிவித்துக் கொள்ள ஆசைப்படுகின்றேன். அமைச்சரிடத்திலே நாங்கள் இந்த கான்ஃபரன்ஸை பற்றி நாங்கள் விவரித்த போது, எங்களுடைய டீமுடன் விவரித்த போது, என்ன இதனுடைய சிறப்பம்சம் என்ன என்று எங்களுடைய கேட்டறிந்தார். அப்போது அவரிடத்தில் நாங்கள் சொன்னது என்னென்றால், தேசிய மருத்துவ ஆணையம் சில விதிமுறைகளை கொடுக்கின்றது. அதாவது NMC is giving a clear-cut instruction that whatever the teaching which you wanted to take for our undergraduate student, it should be an integrated teaching and it should be multidisciplinary. For example, if you want to take a topic about radial nerve or ulnar nerve, how it is clinically related with the clinical medicine, that is the concept behind it. And what we did immediately, we contemplated a template and then we circulated to all the speakers. இதை ஒவ்வொரு விஷயத்தையும் நாங்கள் முன்னெடுக்கின்ற பொழுது எங்களுடைய ஆர்கனைசிங் டீம்ல எந்த மாதிரியான டாபிக்ஸ் மாணவர்களுக்கு சிறப்பாக இருக்கும் என்பதை உணர்ந்து அதற்கான எல்லா விதமான குழுக்களை அமைத்து, அந்த ஒவ்வொரு குழுக்களும் அவர்களுடைய பணிகளை மிக சிறப்பாக செவ்வனவே அவர்களுடைய உள்ளார்ந்த எண்ணத்துடன் இதில் பணியாற்றியது என்பதுதான் இந்த மாநாட்டினுடைய வெற்றியாக நான் பார்க்கின்றேன். ஒவ்வொரு விஷயத்தையும் ஒவ்வொன்றும் நாங்கள் செய்து கொண்டே இருக்கின்ற பொழுது, நேற்றைய தினம் அவரிடத்திலே நான் மீண்டும் தொடர்பு கொண்டு, நாளை தினம் நீங்கள் வருகின்ற நேரத்தை கொடுக்க வேண்டும் என்றால், அவருக்கு இன்றைக்கு காலையிலிருந்து அவருக்கு தொடர்ந்து பணி இருக்கின்றது. இருப்பினும் வராமல் போயிடுவாரா என்ற ஒரு அச்சம் எங்களுக்குள் இருந்து கொண்டே இருக்கின்ற பொழுது மீண்டும் எங்களுக்கு ஒரு மகிழ்ச்சிகரமாக செய்து, நான் கட்டாயம் வந்து விடுவேன், 12 மணி ஆனாலும் 12:30 ஆனாலும் உங்களை நான் சந்திப்பேன் என்கின்ற மகிழ்ச்சிகரமான செய்தியினை நீங்கள் இன்று காலை தெரிவித்தவுடன் எங்களுக்கு கிடைத்த மகிழ்ச்சி என்பது அளவில்லாதது. அவ்வாறாக இந்த மாநாடு இன்று 2 நாட்களாகும் மிக சிறப்பாக கிட்டத்தட்ட 112 மருத்துவக் கல்லூரி மாணவர்கள் இடம்பெறுகின்ற வரலாற்று சிறப்புமிக்க இந்த மாநாட்டில் 12 மாநிலத்தைச் சேர்ந்த மாணவர்கள், ஃப்ரம் கேரளாவிலிருந்து மாணவர்கள் 36 மாணவர்கள், ஆந்திரா அண்ட் தெலுங்கானாவிலிருந்து கிட்டத்தட்ட 90 மாணவர்களுக்கு மேலாக, கர்நாடகாவிலிருந்தும் மாணவர்கள், அது மட்டுமின்றி பாண்டிச்சேரி, ஹரியானா, குஜராத், உத்தரப்பிரதேஷ், இமாச்சல பிரதேசத்திலும் இருந்தும் கூட எங்களுக்கு யூனியன் டெரிட்டரியில் இருந்தும் மாணவர்கள் எல்லாம் வந்திருக்கின்றார்கள். நாங்கள் இந்த கான்ஃபரன்ஸை விட்டு வெளியே வருகின்ற பொழுது, அவர்கள் எங்களுடன் உரையாடுகின்ற பொழுது அவர்கள் எங்களிடம் பகிர்ந்த மகிழ்ச்சி என்பது எங்களுக்கு இந்த மாநாட்டில் கிடைத்த வெற்றியாகவே நான் கருதுகின்றேன். இந்த வெற்றி என்பது, இந்த மாநாட்டின் வெற்றி என்பது எங்கள் குழுக்கு கிடைத்த மிகப்பெரிய வெற்றி. இது நல்ல முறையில் இந்த மாணவர்கள் அனைவரும் சிறப்பான ஒரு எதிர்காலத்திலும் சிறப்பாக வர வேண்டும் என்கின்ற கேரியர் கைடன்ஸ், அவர்களுடைய எதிர்கால வழிகாட்டுதல் எவ்வாறு அமைய வேண்டும் என்று ஐஏஎஸ் ஆகின்றவர்கள் எப்படி வந்து மருத்துவர்கள் ஐஏஎஸ் ஆனார்களோ அவர்களை கொண்டும் வெளிநாடுகளில் இருந்து மருத்துவர்களை கொண்டும் ஒரு கேரியர் டிஸ்கஷன், பேனல் டிஸ்கஷன் இன்றைய தினம் ஏற்பாடு செய்யப்பட்டுள்ளது. முத்தாய்ப்பான இந்த மாநாட்டினுடைய அம்சம் என்னவென்றால் ஒன் ஹெல்த் கான்செப்ட். எங்குமே நீங்கள் வந்து பிளாஸ்டிக்கை வந்து இந்த மாநாட்டில் 3 நாட்களும் பார்க்காத வண்ணம் இதை நாங்கள் ஏற்பாடு செய்தோம் என்றால் அந்த பெருமைக்கு அனைவரும் உறுத்தாகுகின்றோம். ஒவ்வொரு விஷயத்தை நான் பேசிக்கொண்டே போனால் இதற்கான இதுவே இல்லை. அனைவருக்கும் என்னுடைய நெஞ்சார்ந்த நன்றிகளையும், இந்த மாநாட்டுக்கு வந்திருக்கின்ற மாணவ செல்வங்கள் அனைவரையும் இதயம் கணிந்து வருக வருக என்று வரவேற்று மக்கள் நல்வாழ்வுத்துறை அமைச்சர்களின் கைகளால் சிறப்பு அவார்டுகளையும் விருதுகளையும் பெறுகின்ற மாணவர்களுக்கும் என்னுடைய வாழ்த்துக்களை தெரிவித்து அமர்கின்றேன். நன்றி, வணக்கம்.
Thank you very much, sir. May I request our organizing chairperson, Theran Rajan sir, to kindly felicitate our Honorable Health Minister, please.
இந்த மாநாட்டுக்கு நாங்கள் வந்து செவனர் வந்து நாங்கள் கேட்ட உடனே தமிழகத்தினுடைய முதல்வர் அவர்கள் உடனடியாக எங்களுக்கான வாழ்த்து மடலை இந்த மருத்துவ மாநாட்டிற்கு வழங்கியதற்கு மிகுந்த நன்றியினும் நெஞ்சார்ந்த நன்றிகளும் நாங்கள் எங்கள் மருத்துவ செல்வங்கள் மூலமாக தெரிவித்துக் கொள்வதிலே நான் பெருமைப்படுகின்றேன்.
Moving on to the prize distribution ceremony, I may now request our Honorable Health Minister, sir, to honor the prize winners. Poster presentation competition. First place, Jennifer Stephens, Sri Devraj Urs Medical College. First place, Jennifer Stephens, Sri Devraj Urs Medical College, for the poster presentation competition. Second place, Pratap Dayanidhi and Prasanna Priya from Government Medical College, Nilgiris. Second place for poster presentation, Pratap Dayanidhi and Prasanna Priya for Government Medical College, Nilgiris. Moving on to the next online competition results. Just a minute competition. First prize goes to Hari Vignesh Umashankar, Government Stanley Medical College. Second prize goes to K. Hakshita, Savita Medical College and Hospital. Next being Paint Your Thought competition. The first prize goes to G. Madan, Government Kalakurchi Medical College. Second prize is backed by Samyukta N, Government Viluppuram Medical College and Hospital. Photo voice competition. First prize, Bitra Kavya Anaika, Government Stanley Medical College. Second prize goes to Sasi Rekapik, Government Medical College and Hospital, Pudukottai. Next up on the list is game-based learning competition. First prize, Siddesh R, Government Pudukottai Medical College and Hospital. And second prize is backed by Avinash S, Government Thiruvarur Medical College and Hospital. Last but not the least, reflective writing competition. The first prize is backed by Sriram Babu, Madurai Medical College, and second prize by Kadali Pabat Reddy, Nilima Institute of Medical Sciences. Our UG student Tarunesh gets a prize for suggesting the name Miracle for this conference. I request Scientific Secretary Sunil to hand over a copy of Souvenir and stamp released during the inauguration. I repeat, Tarunesh, our very own MBBS student, gets a memento next for suggesting the name Miracle for this conference. Give a huge round of applause for all the prize winners. உள்ளத்தில் உண்மையொளி உண்டாயின் வாக்கினிலே ஒளி உண்டாகும் என்ற மகாகவியின் வார்த்தைகளுக்கு எடுத்துக்காட்டாக சொல்லிலும் செயலிலும் உண்மையும் நேர்மையும் கொண்டு தமிழக மக்களின் நலம் காண பாடுபடும் எங்கள் மாண்புமிகு சுகாதாரம் மற்றும் குடும்ப நலத்துறை அமைச்சர் திரு மா சுப்பிரமணியம் அவர்களை இவ்விழாவிற்கு வருக வருக என வரவேற்பதில் பெரும் மகிழ்ச்சி அடைகிறேன். May I now request you to address the gathering, sir?
சென்னை மருத்துவக் கல்லூரி நடத்தும் மிராக்கல் 25 என்கின்ற இந்த மகத்தான மாநாட்டிற்கு வருகை தந்து எனக்கு முன்னால் உரையாற்றி சிறப்பித்து வீற்றிருக்கிற தமிழக அரசின் முதன்மை செயலாளர், இந்த துறையின் செயலாளர், பெருமதிப்பிற்கும் பாராட்டுதலுக்கும் உரிய டாக்டர் பி செந்தில்குமார் IAS அவர்களே, நிகழ்ச்சியில் பங்கேற்று சிறப்பித்துக் கொண்டிருக்கின்ற தேசிய நலவாழ்வு குழுமத்தின் இயக்குனர் பெருமதிப்பிற்குரிய டாக்டர் அருண் தம்புராஜ் IAS அவர்களே, நிகழ்ச்சியில் இந்த சிறப்பான மாநாட்டை மிக சிறப்பாக நடத்துவதற்கு எல்லா வகையிலும் காரணமாக இருந்து கொண்டிருக்கின்ற கூடுதல் மருத்துவ கல்வி இயக்குனர் பெருமதிப்பிற்குரிய டாக்டர் தேரணி ராஜன் அவர்களே, நிகழ்ச்சியில் பங்கேற்று சிறப்பித்துக் கொண்டிருக்கின்ற பெருமதிப்பிற்குரிய டாக்டர் கவிதா அவர்களே, வருகை தந்து சிறப்பித்துக் கொண்டிருக்கின்ற மருத்துவர் பெருமக்களே, இந்தியாவின் 12 மாநிலங்களிலிருந்து ஏறத்தாழ 100க்கும் மேற்பட்ட கல்லூரிகளில் இருந்து வருகை தந்து சிறப்பித்துக் கொண்டிருக்கின்ற மருத்துவ கல்வி மாணவ மாணவியர்களே, பத்திரிகை மற்றும் ஊடகவியலாளர்களே, உங்கள் அத்தனை பேருக்கும் முதலில் என்னுடைய நன்றி கலந்த வணக்கத்தினை தெரிவித்துக் கொள்கின்றேன். நான் பெருமதிப்பிற்குரிய திரு தேரணி ராஜன் அவர்களிடம் இதற்கு முன்னால் இந்தியாவில் இது போன்றதொரு மாநாடு வேறு எப்போதாவது எங்கேயாவது நடைபெற்றிருக்கிறதா என்று கேட்டேன். அவர் சொன்னார், இதுவரை இந்தியாவில் எந்த மாநிலத்திலும் இது போன்று 3 நாட்கள் இவ்வளவு பெரிய மாநாடு மருத்துவ கல்வி மாணவர்களிடையே நடத்தப்பட்டதில்லை என்கின்ற வகையில் ஒரு மிக சிறப்பான கருத்தினை சொன்னார். தமிழ்நாட்டில் மருத்துவ கட்டமைப்பு என்பது ஒரு மிகப்பெரிய அளவில் இந்தியா மட்டுமல்ல, உலக நாடுகள் பலவும் பாராட்டுகிற வகையில் பல்வேறு வகையிலான மருத்துவ கட்டமைப்பு தமிழ்நாட்டில் இருந்து கொண்டிருக்கிறது. 8713 துணை சுகாதார நிலையங்களும் 2286 ஆரம்ப சுகாதார நிலையங்கள் மற்றும் நகர்ப்புற சுகாதார நிலையங்களும் 500 நகர்ப்புற நலவாழ்வு மையங்களும் 262 வட்டார மருத்துவமனைகளும் 37 மாவட்ட அரசு மருத்துவமனைகளும் 36 மருத்துவக் கல்லூரி மருத்துவமனைகளும் 22 இன்றைக்கு இந்திய மருத்துவத்துறையைச் சேர்ந்த மருத்துவமனைகளும் 3 பல் மருத்துவக் கல்லூரிகளும் 2 பன்னோக்கு மருத்துவமனைகளும் என்று ஏறத்தாழ 11,876 மருத்துவ கட்டமைப்புகள் தமிழ்நாட்டில் இருந்து கொண்டிருக்கிறது. இந்தியாவில் ஒரு 36 மாநிலங்கள் இருந்தாலும் கூட இந்த அளவுக்கு 11,000க்கும் மேற்பட்ட சற்றொப்ப 12,000 மருத்துவ கட்டமைப்புகள் இருக்கிற ஒரே மாநிலம் தமிழ்நாடு என்பது மகிழ்ச்சிக்குரிய ஒன்று. அந்த வகையில் இந்த மருத்துவ கட்டமைப்பு என்பது மிகப்பெரிய அளவில் பல்வேறு வகையிலான சாதனைகளை படைத்துக் கொண்டிருக்கிறது. மாண்புமிகு தமிழ்நாட்டின் முதலமைச்சர் அவர்கள் 2021 ஆகஸ்ட் திங்கள் 5ஆம் தேதி கிருஷ்ணகிரி மாவட்டத்தில் சாமனப்பள்ளி என்கின்ற இடத்தில் ஒரு திட்டத்தை தொடங்கி வைத்தார். மக்களை தேடி மருத்துவம் என்கின்ற திட்டம். தமிழ்நாடு முழுவதும் இருக்கிற மக்களை தேடி டயபெட்டிக், ஹைப்பர்டென்ஷன், பேலியேட்டிவ் கேர், பிசியோதெரப்பி, டயாலிசிஸ் போன்ற நோய்களுக்கு வீடுகளுக்கே தேடிச் சென்று மருத்துவம் பார்க்கிற அந்த மகத்தான திட்டத்தை மாண்புமிகு முதல்வர் அவர்கள் தொடங்கி வைக்கிற போது சொன்னது, முதல் பயனாளிக்கு இன்றைக்கு மருந்து பெட்டகத்தை தந்திருக்கிறோம், 1 கோடி பயனாளர்களை இந்த திட்டம் விரைவில் சென்றடைய வேண்டும் என்கின்ற வகையில் தன்னுடைய விருப்பத்தை தெரிவித்தார்கள். ஆனால் இன்றைக்கு அது தமிழ்நாட்டில் 2,24,00,000 பயனாளிகளை கடந்து வெற்றிகரமாக நடைபெற்றுக் கொண்டிருக்கின்றது. அதனால்தான் ஐநா மன்றம் கடந்த செப்டம்பர் திங்கள் 25ஆம் தேதி அமெரிக்காவின் நியூயார்க் நகரில் ஒரு பொது சபை கூட்டத்தில் உலக நாடுகளில் தொற்றா நோய்களுக்கு, நான் கம்யூனிகபிள் டிசீஸ் என்று சொல்லக்கூடிய தொற்றா நோய்களுக்கு சிகிச்சை அளிப்பதில் எந்த பகுதி சிறந்து விளங்குகிறது என்று அவர்கள் ஆராய்ந்த போது தமிழ்நாடு மிக சிறப்பாக செய்து கொண்டிருக்கிறது என்பதை தெரிந்து தமிழ்நாட்டிற்கு 2024ஆம் ஆண்டுக்கான உலகளாவிய ஒரு விருது இன்றைக்கு ஐநா மன்றத்தால் அறிவிக்கப்பட்டது. யுனைடெட் நேஷன்ஸ் இன்டர் ஏஜென்சி டாஸ்க் போர்ஸ் அவார்டு என்கின்ற ஒரு விருது தமிழ்நாட்டிற்கு இன்றைக்கு கிடைக்கப்பட்டிருக்கிறது. இப்படி பல்வேறு திட்டங்களை நாம் சொல்லி செல்லலாம். இன்னுயிர் காப்போம், நம்மை காக்கும் 48, இதயம் காப்போம், சிறுநீரக பாதுகாப்பு திட்டம், பாதம் பாதுகாப்போம், நடப்போம் நலம் பெறுவோம், மக்களை தேடி மருத்துவ ஆய்வக திட்டம், தொழிலாளர்களை தேடி மருத்துவ திட்டம், செயற்கை கருத்தறுத்தல் மையங்கள் என்று பல சிறப்புக்குரிய திட்டங்கள் தமிழ்நாட்டில் மிக சிறப்பாக இன்றைக்கு நடைமுறையில் இருந்து கொண்டிருக்கிறது. இந்த திட்டங்கள் எல்லாம் இந்தியாவுக்கே வழிகாட்டும் திட்டங்களாக இருந்து கொண்டிருக்கிறது. நேற்றைக்கு முன்தினமும் பூனேவில் இந்திய மருத்துவத்திற்கான ஒரு மாநாட்டில் நம்முடைய துறையின் செயலாளர் பெருமதிப்பிற்குரிய டாக்டர் செந்தில்குமார் அவர்கள் சென்றிருந்தார்கள். நேற்று காலை அவரிடத்தில் நான் பேசிக் கொண்டிருந்த போது அவர் சொன்ன ஒரு நல்ல விஷயம், இந்தியா முழுமைக்கும் இருந்து வருகை தந்திருந்த அமைச்சர்கள் மற்றும் அலுவலர்களிடையே தமிழ்நாட்டில் நாம் ஆயுஷ் நிர்வாகத்தில் குறிப்பாக சித்தா, யோகா, யுனானி, ஹோமியோபதி போன்ற ஆயுர்வேதா போன்ற பல்வேறு இந்த இந்திய மருத்துவ முறைகளில் நாம் செய்து கொண்டிருக்கிற நல்ல விஷயங்களை அங்கே பட்டியல் போட்டு காட்டி அவரை பிரசன்டேஷன் செய்ய சொன்னார்கள் என்கின்ற விஷயத்தை அவர் சொன்னபோது, உண்மையில் தமிழ்நாடு இன்றைக்கு மருத்துவ கட்டமைப்பில் மட்டுமல்ல, மருத்துவ கல்வியிலும் அதேபோல் இந்திய மருத்துவத்திலும் கூட மிக சிறப்பான வகையில் இந்தியாவுக்கு ஒரு வழிகாட்டி மாநிலமாக இருந்து கொண்டிருக்கிறது என்பது மகிழ்ச்சிக்குரிய ஒன்று. அந்த வகையில் இன்றைக்கு நம்முடைய தேரணி ராஜன் அவர்கள் இந்த மிக சிறப்பான மாநாட்டை நடத்தி கொண்டிருக்கிறார்கள். மாணவர்களை 2-3 நாட்கள் ஒரு அரங்கத்தில் உட்கார வைத்து, குறிப்பாக 2000க்கும் மேற்பட்ட மருத்துவ கல்வி மாணவர்களை ஒரே இடத்தில் அமர வைத்து அவர்களுக்கு பயிற்றுவிப்பதாக இருந்தாலும் சரி, அல்லது எந்த விஷயமாக இருந்தாலும் ஒரு இடத்தில் இவ்வளவு மாணவர்களை ஒரு சேர நிகழ்ச்சிகளை ஒருங்கிணைத்து நடத்துவது என்பது யாரும் நினைத்தே பார்க்க முடியாத காரியம். சிறப்பான காரியத்தை பெருமதிப்பிற்குரிய தேரணி ராஜன் அவர்களும் மருத்துவர் கவிதா அவர்களும் மிக சிறப்பாக செய்திருக்கிறார்கள். அதற்காக அந்த இரு பெருமக்களையும் நான் மகிழ்ச்சியோடு இந்த துறையின் சார்பில் பாராட்டவும் வாழ்த்தவும் கடமைப்பட்டிருக்கின்றேன். நம்முடைய இந்த துறை பற்றி உங்களுக்கு நன்றாக தெரியும். கடந்த 4 ஆண்டுகளில், ஏனென்றால் நீங்கள் எல்லாம் பெரும்பகுதியானவர்கள் தமிழகத்தைச் சேர்ந்தவர்கள் என்றாலும் அக்கம்பக்கத்திலிருந்து ஆந்திரா, தெலுங்கானா, கேரளா, கர்நாடகா போன்ற பல்வேறு மாநிலங்களிலிருந்து வருகை தந்திருந்தாலும் ஓரளவுக்கு நான் பேசும் மொழி உங்களுக்கு தெரியும் என்பது எனக்கும் தெரியும். காரணம், திராவிட மொழிகள் அனைத்து மொழிகளுக்குமே இருக்கிற ஒற்றுமை எல்லோருமே உணர்ந்தவைகள்தான். தமிழ் தெரிந்தால் தெலுங்கு தெரியும், தெலுங்கு தெரிந்தால் கன்னடம் தெரியும், கன்னடம் தெரிந்தால் மலையாளம் தெரியும், மலையாளம் தெரிந்தால் துளுவம் தெரியும். ஆக இந்த 5 மொழிகளுக்கும் ஒன்றுக்கொன்று தொடர்பு இருக்கிறது. உதாரணமாக ஏராளமான மாணவர்கள் கர்நாடகத்திலிருந்தும் ஆந்திராவிலிருந்தும் வந்திருக்கிறார்கள் என்று சொன்னார்கள். புரட்சி பாவேந்தர் பாரதிதாசன் கூட ஒரு பாடலில் சொல்லியிருப்பார், கோழி என்றால் தெலுங்கு, கோழி என்றால் தமிழ், கோடி என்றால் தெலுங்கு, கோலி என்றால் கன்னடம், கோலி என்றால் துளுவம். இது மாதிரி எல்லாமே இந்த கோழி, கோடி, கோலி இது மாதிரி தான் வரும் இந்த கோழி என்னும்போது. அதே மாதிரி 1, 2, 3ன்னு எடுத்துக்கணும்னா 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. இதுவே தெலுங்குல சொன்னோம்னா 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. அதே மலையாளத்தில் சொல்லணும்னா 1, 2, 3, 4, 5, 6 இது கன்னடம். இது மாதிரி ஒரே மாதிரி தான் இருக்கும். ப்ரொனவுன்சேஷனை பொறுத்த வரைக்கும் அதில் மாற்றமே இருக்காது. அதனால் வருகை தந்திருக்கிற உங்கள் அனைவருக்குமே தமிழில் பேசினால் புரியும் என்பதற்காக சொல்லுகிறேன். தமிழ்நாட்டில் இந்த மருத்துவ கல்வி மருத்துவ கட்டமைப்பு மிக சிறப்பான இடத்தில் இருந்து கொண்டிருக்கிறது. குறிப்பாக இந்த 4 ஆண்டுகளில் மாண்புமிகு தமிழ்நாட்டின் முதலமைச்சர்களால் இன்றைக்கு கொண்டு வரப்பட்டிருக்கிற மிக சீரிய திட்டங்கள் இன்றைக்கு உலகத்திற்கு வழிகாட்டும் திட்டங்களாக இருந்து கொண்டிருக்கிறது. நீங்கள் எல்லாம் படித்து முடித்துவிட்டு அரசு வேலைகளுக்கு வருகிற போது மற்ற மாநிலங்களில் எப்படியோ இங்கே மெடிக்கல் சர்வீசஸ் ரெக்ரூட்மெண்ட் போர்டு என்கின்ற ஒரு மருத்துவ பணியாளர் தேர்வாணையம் ஒன்று இருக்கிறது. மிக சிறப்பான வகையில் நேர்மையான முறையில் தகுதியானவர்களுக்கு அதுவும் மிக மிக சரியான வகையில் தேர்வு நடத்தப்பட்டு இன்றைக்கு இதுவரை கடந்த 4 ஆண்டுகளில் 25,295 பேருக்கு பணியாணைகள் வழங்கப்பட்டிருக்கிறது. மருத்துவர்கள், செவிலியர்கள், மருத்துவம் சார்ந்த களப்பணியாளர்கள் என்று மிக நேர்மையான முறையில் 25,295 பணியிடங்கள் தமிழ்நாட்டில் நிரப்பப்பட்டிருக்கிறது. இன்னொரு செய்தியை நீங்கள் தெரிந்து கொள்வது நல்லது. கடந்த மாதம் ஒரு தேர்வு நடைபெற்றது. 48 பல் மருத்துவர்களுக்கு தேர்வு. இந்த 48 பல் மருத்துவர்களுக்கு எவ்வளவு பேர் தேர்வு எழுதியிருக்கிறார்கள் என்றால், அரசு மருத்துவ பணியில் சேர்வதற்கு எந்த அளவுக்கு மருத்துவர்கள் தயாராக இருக்கிறார்கள் என்பதற்கு ஒரு உதாரணம். இந்த 48 பல் மருத்துவர்களுக்காக தேர்வு எழுதியிருப்பவர்களுடைய எண்ணிக்கை 11,720 பேர். 48 காலி பணியிடங்களுக்கு 11,720 பேர். அதில் தேர்வாகியிருப்பவர்கள் ஏறத்தாழ 8,000த்திற்கும் மேற்பட்டவர்கள் பாஸ் செய்திருப்பவர்கள். இந்த பாஸ் செய்திருப்பவர்கள் 8,000த்திற்கும் மேற்பட்டவர்களில் ரேங்கிங், கம்யூனியல் ரொட்டேஷன், சர்டிஃபிகேட் வெரிஃபிகேஷன் இதெல்லாம் முடித்து 48 பேரை செலக்ட் பண்ணணும். எவ்வளோ பெரிய சவாலான வேலை எம்ஆர்பி நிர்வாகத்திற்கு இருக்கிறது என்பதை நாம் புரிந்து கொள்ள வேண்டும். அந்த அளவுக்கு வெளிப்படை தன்மையோடு இந்த என்னிடத்தில் கூட யாராவது சிபாரிசுக்கு வருகிற போது நான் சொல்வது, நீங்கள் பெற்றோர்கள் சிபாரிசுக்கு வருகிறீர்கள், உங்களுடைய குழந்தைகளுக்கே தெரியும் இது யாருக்கு கிடைக்க போகிறது என்று. ஒவ்வொரு இனத்திற்கும் கட் ஆஃப் மார்க் இருக்கிறது. எஸ்சிக்கு இவ்வளோ, எஸ்டிக்கு இவ்வளோ, எம்பிசிக்கு இவ்வளோ, பிசிக்கு இவ்வளோ, இந்த மாதிரி கட் ஆஃப் மார்க் சொல்லப்பட்டிருக்கிறது. இதிலிருந்து அவங்களே முடிவெடுத்துப்பாங்க இது யார் இந்த 48 பேருங்கிறத. எம்ஆர்பி டைரக்டரோ சேர்மனோ சொல்றதுக்கு முன்னாடி ஸ்டூடெண்ட்ஸே முடிவெடுத்துருவாங்க யார் இந்த 48ங்கிறது. அந்த அளவுக்கு வெளிப்படை தன்மையோடு இன்றைக்கு இந்த அரசு பணியிடங்களை நிரப்பி கொண்டிருக்கிறது. அண்மையில் கூட 2,642 மருத்துவர் பணியிடங்கள் எம்பிபிஎஸ் படித்தவர்களுக்கான அந்த பணியிடங்கள் நிரப்பப்பட்டது. இந்த 2,642 பேருக்கு 24,000 பேர் தேர்வு எழுதினார்கள். இதில் 2,642 பேர் தேர்ந்தெடுக்கப்பட்டு இன்றைக்கு வெளிப்படை தன்மையுடனான இந்த தேர்வு முடிவுற்று இந்தியாவில் முதன்முறையாக அவரவர்கள் விரும்புகிற இடத்திற்கு ஃப்ரெஷ் கேண்டிடேட்டுக்கு கவுன்சிலிங் நடத்தி விரும்புகிற இடத்திற்கு பணியாணைகள் தந்து கொண்டிருப்பது என்பது தமிழ்நாடு அரசு என்பதை மகிழ்ச்சியோடு தெரிவித்துக் கொள்கின்றேன். இதை உங்களிடையே சொல்வதற்கு காரணம், நீங்களும் கூட படித்து முடித்துவிட்டு திறமை உள்ளவர்களாக மிக சிறந்த வகையில் இதில் நீங்கள் தேறி உங்களுடைய தேர்வுகளை எதிர்காலத்தில் அரசு பணிக்கு வருகிற போது வெறும் மெரிட் மட்டுமே மனதில் கொண்டு இதில் நீங்கள் தேர்ச்சி பெறுவதற்கு ஏராளமான வாய்ப்புகள் இருக்கிறது. சிபாரிசுகள் தேவையில்லை, எந்த விதமான யாரிடத்தையும் போய் அணுக வேண்டிய அவசியமும் இல்லை என்கின்ற வகையில் இந்த தமிழ்நாட்டின் மருத்துவத்துறையில் பணியிடங்கள் நிரப்பப்படுவதும், அதேபோல் ஏற்கனவே இருக்கிற மருத்துவ பணியிடங்களில் கலந்தாய்வு என்பதும் கவுன்சிலிங் முறையில் பல கலந்தாய்வு நடத்தப்பட்டு கடந்த 4 ஆண்டுகளில் மட்டும் 42,718 இடங்களுக்கு கலந்தாய்வு நடத்தப்பட்டு நேர்மையான முறையில் பணி மாறுதல்கள் நடைபெற்றிருக்கிறது என்பதை மகிழ்ச்சியோடு தெரிவித்துக் கொள்கின்றேன். காரணம், நீங்களும் கூட எதிர்காலத்தில் தமிழ்நாட்டில் மருத்துவர்களாகவும் மருத்துவம் சார்ந்த பணியிடங்களுக்கு வருகிற போது இந்த பணியிடங்களை நேர்மையாக நிரப்பிக்கொள்ள முடியும். நானும் தகுதியுள்ள வகையில் அதற்காக உழைப்பேன், படிப்பேன் என்கின்ற வகையில் இருந்து வரலாம் என்கின்ற வகையில் இந்த செய்தியை உங்களிடத்தில் பகிர்ந்து கொண்டு, இந்த நிகழ்ச்சியை நீங்கள் நடத்தி கொண்டிருக்கிற தலைப்பு MIRACLE'25. இப்பொழுது இந்த மிராக்கல் தலைப்பு வைத்த மாணவருக்கு இப்பொழுது பரிசு தரப்பட்டது. உண்மையில் ஒரு சிறந்த பரிசு. நானும் கூட நம்முடைய NHM MD இடத்தில் கேட்டேன், சரியான தமிழ் அர்த்தம் என்னவா இருக்குன்னு கேட்டேன். 2-3 சொன்னாங்க, அதிசயம், அற்புதம் இதெல்லாம் சொன்னாங்க. சரி கூகுளில் போய் தான் பார்ப்போம் இதுக்கு உண்மையான அர்த்தம் என்னவா இருக்குன்னு பார்த்தா அதில் அதிசயம்னு போட்டிருந்து. எனவே இந்த மாநாடு அதிசயமான மாநாடு. பங்கேற்றிருக்கிற நீங்கள் எல்லாமே அதிசயமானவர்கள். வாய்ப்புக்கு நன்றி கூறி விடைபெறுகிறேன். நன்றி, வணக்கம்.
Thank you very much for excellent presidential address, sir. We are blessed and honored by your presence. May I request Kavita ma'am to kindly come forward for the vote of thanks, please.
இங்கு கூடியிருக்கும் அனைவருக்கும் எனது நன்றியை தெரிவித்துக் கொள்கிறேன், வணக்கத்தை தெரிவித்துக் கொள்கிறேன். மாண்புமிகு மக்கள் நல்வாழ்வுத்துறை அமைச்சர் அவர்கள் இந்த ப்ரோக்ராம் நாங்கள் பண்ணும்போது இந்த மல்டி டிசிப்ளினரி அப்ரோச் ஆஃப் இன்டிகிரேட்டட் லேர்னிங்ன்றது தான் இதோடைய முக்கியமான அமைப்பு. அதில் ஐயா அவர்கள் லாங்குவேஜ் இன்டகிரேஷன்னு சொல்லி அதில் 1, 2, 3 எப்படி எல்லா லாங்குவேஜும் இன்டகிரேட் ஆகுதுன்றதை சொல்லியிருக்கிறார். அவர் இங்கே வருகை தந்து எங்களில் ஒருவராக, இந்த எம்எம்சி குடும்பத்தில் ஒருவராக இருந்ததுக்கு எங்கள் நன்றியை தெரிவித்துக் கொள்கிறோம். இங்கே கூடியிருக்கும் அனைவருக்கும் எனது மனமார்ந்த நன்றி. இங்கே கூடியிருக்கும் மாணவர்கள் மற்றும் பெரியவர்கள் மற்றும் மேடையில் அமைந்திருக்கும் வல்லுநர் அனைவருக்கும் எனது நன்றியை தெரிவித்துக் கொள்கிறேன். நன்றி.
Thank you so much, ma'am. I may now request all the faculties to assemble for a group photo on the stage. An announcement to the delegates. We have one more session before the lunch begins. All of you please retain back in your seats. Thank you so much for your presence, sir. Let us all now break for lunch. We may now break for lunch. The lunch session is up to 2 o'clock. We'll be starting our session sharp at 2. Thank you so much, sir.